Assalamu alaikum warahmatullahi wabarakatuh. Hello Journal Club listeners. The paper I'm about to present is titled as Clinical and Radiographic Outcome of Root Canal Treatment of Infected Teeth with Associated Sinus Tracts. It's a retrospective study by the Argentinian Liliana Artaza along with Rojas and Siqueira. It was published at the Australian Endodontic Journal in 2021. There are many studies that have reported that the presence of a sinus tract does not significantly influence the prognosis of an endodontic treatment. However, a large cohort study showed a worse prognosis for teeth with sinus tract than teeth without. In addition to this inconsistency in the results, there has been no clear correlation between the healing of a sinus tract in a few days or weeks after the treatment and the healing of the apical periodontitis lesions 1 or more years later. This study aimed to evaluate the short and long-term outcomes, both clinical and radiographical, of root canal treatment or retreatment in such cases. They included 72 teeth, all treated by a single operator over 20 years period, all associated with chronic apical abscesses and intraoral sinus tracts. The time frame was between 1999 to 2019, all treated in a private practice. The sinus tract healing tracked at 7, 14, 21, and 30 days for the short-term follow-up, and for the long-term follow-up, clinical and radiographic evaluation using the PIA, the periapical index, with classifications of healed, healing, or diseased. The result shows the long-term outcomes were categorized as healed in 73% of the cases, while 8% were categorized as healing, showing reduced lesion size without complete resolution, and 18% of the teeth remain diseased with persistent or recurrent symptoms or radiolucencies. The majority, 94.4% of the sinus tracts, closed within the first 30 days following the treatment. Early closure, particularly within the first month, was strongly associated with eventual periapical healing, making it a promising predictor for the long-term success. This early closure was not just a sign of symptomatic relief, but also a strong clinical predictor of a deeper periodicular healing observed later during the follow-up. In contrast, delayed or recurrent sinus tracts were highly predictive of treatment failure. There were 4 teeth with sinus tract that failed to close within the first month, along with 5 others where sinus tracts recurred after initially closing. These 9 cases made up 69% of all treatment failures. We could conclude from this that if the sinus tract resolves early, we can reasonably be confident in the long-term periapical healing. While on the other hand, if the sinus tract persists beyond this period or recurs, it may signal a persistent or an extraradicular infection, potentially requiring further interventions such as retreatment, apical surgery, or extraction and prosthetic placement. And when examining potential risk factors, the study found no statistically significant difference from variables such as the patient's age, gender, type of the tooth, the lesion size, or the obturation technique used. However, one key factor that did correlate with the treatment failure was the absence of a final corona restoration. Teeth that were left without a permanent crown or a filling had a significantly higher rates of failure, highlighting the critical role of coronal sealing in the treatment prognosis. How significant? Of the 4 teeth without any corona restoration, 75% of them were classified as disease. This failure rate was substantially higher compared with teeth with corona restoration. In other words, teeth without a restoration were over 4 to 5 times more likely to fail than those with some form of coverage, even if imperfect. This emphasizes that not placing a permanent restoration can greatly compromise the success of the root canal treatment. Finally, the study has some limitations, starting by its retrospective design with the inherent biases and incomplete follow-up for some of the patients, and it also has a low statistical power. In conclusion, one of the key takeaways from this study is the strong predictive value of early sinus tract closure. Quick closure of the sinus tract, especially within the first 30 days, is a strong predictor of the long-term healing, and that proper corona restoration is essential to success. Even in complex infections, effective root canal treatment can lead to favorable outcomes. And thank you so much for listening. Hope you have a great day. Bye.